Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing a case study and we're going to be covering prioritization. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, part 1 and part 2. In part 1, I teach you how to think critically. I teach you about different phrases and situations that may be presented to you on NCLEX and where your mind is supposed to go. I teach you about prioritization, delegation. And then in part 2, we actually go over NCLEX type questions, rationales, and most importantly, how to apply those rationales to the type of questions you should expect to see. If you're currently in the nursing program, I have audio lessons available for you. If you are one of those students that are not doing well and you really have to get a high grade on your next exam, go check out my audio lessons and see if I have one that matches the next exam that you're going to be taking. If you want private tutoring, you can sign up for a private tutoring session with me. I book very quickly, but I offer it. You can sign up for a private tutoring session with me. Maybe you want to pick my brain about something. Maybe you need some advice about something within the nursing arena. You can sign up for a consultation session. All of those resources can be found on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Now, without any further ado, guys, let's get started. So take a look at this case study. It says that you are the nurse on a busy medical surgical unit and you're assigned these following patients. Here are your patients. Your first patient, Mr. John Miller. This is a 78-year-old recently diagnosed with pneumonia. He's receiving IV antibiotics and oxygen therapy. He's experiencing a productive cough, mild shortness of breath, and low-grade fever. Your second patient, Miss Sarah Collins, 54-year-old post-operative day 1, following a right hip replacement. She's stable but complaining of moderate pain at the surgical site and is on a PCA for pain management. Your third patient, Mr. Henry Davis, a 65-year-old diabetic admitted for an episode of diabetic ketoacidosis. He's being treated with IV insulin and fluids, and his blood glucose being monitored frequently. He's been vomiting and is alert but confused at times. Your fourth patient, Miss Laura Edwards, a 40-year-old with a history of congestive heart failure and hypertension, admitted with worsening shortness of breath and swelling in her legs. She's receiving diuretics and her vital signs are stable, but she continues to experience dyspnea. And last, Mr. James Harris, a 90-year-old with advanced dementia in the end stages of Parkinson's disease. He's nonverbal, unable to move independently, and requires total care for activities of daily living. He's on comfort care measures and his family is at the bedside. So this is the clinical picture of your patients. Okay, so I have a couple questions that I'm going to ask, and I'll give you guys a second to think about it. So here's my first question, guys, and you're not going to be able to see it on the screen because you have all of your different patients and there's scenarios that you need to be looking at, but just listen carefully. Which patient should you assess first? Okay, look at all 5 of your patients and tell me which patient you think needs to be assessed first. And I'll give you a second to review this information. Okay, guys. The first patient that you're going to assess is going to be Mr. Henry Davis. That 65-year-old going into, well, he's not even going into, he's actually having an episode of DKA. Whenever you have a question asking which patient you're going to assess first, what the question is really asking you is which scenario is most lethal, most deadly, okay? Who is most at risk? This patient that's in diabetic ketoacidosis, he's currently getting insulin and IV fluids, but let's keep going. It says that his blood pressure, his blood glucose is being monitored frequently. He's been vomiting. He's been vomiting. Why are we concerned about that? First of all, we're concerned about DKA, period. That's life-threatening, right? And the fact that this patient's vomiting, DKA, what else are we concerned about? Fluid electrolytes, vomiting, dehydration. When you're thinking about physiological integrity, guys, physiological integrity, anything that physically keeps your patient alive or that can harm them or that is lethal to them, that's always going to be your priority. What falls under physiological integrity? I've said this to you guys a million times. Severely abnormal vital signs, severely abnormal hemodynamic status, or fluid and electrolytes, especially sodium and potassium. Hypoglycemia, what kills you faster, hypoglycemia or hyperglycemia? Hypoglycemia. But this patient's in DKA, their blood sugar is high, but what are we concerned about? That dehydration from all that vomiting. We're concerned about that high glucose. We're concerned about this patient's metabolic status. Okay, so that is who we're going to assess first. This is the most lethal situation out of all the patients that we're looking at. Question number 2. You're now preparing to administer medications to your patients. Which medication order would you verify with the healthcare provider before administering? Which medication order would you question? I'm going to give you the orders. If you are ordered to give IV antibiotics to Mr. Miller with pneumonia, if you were ordered to give IV dextrose to Mr. Davis, who's in DKA, if you were ordered to give pain medication to Miss Sarah Collins, who just had the hip replacement, or if you're ordered to give diuretics to Miss Laura Edwards, who is in CHF. Which medication order would you question? Would it be IV fluids for Miller, IV dextrose for Davis, pain medication for Collins, or diuretics for Edwards? What do you guys think? And guys, what you would question would be the IV dextrose for Mr. Davis. Mr. Davis is in DKA, diabetic ketoacidosis. With those high glucose levels, why in the world would we want to increase it further by giving that patient dextrose, right? Look at the clinical picture. Nothing in this picture tells us that this patient would need dextrose that would elevate that patient's glucose levels. Next question. Which patient requires immediate intervention based on the latest lab results and their clinical status? Looking at this list of patients, who would require immediate nursing intervention? And I'm sure you guys all got this correct. Again, Mr. Davis, diabetic ketoacidosis. That's who you're going to see first. That's the patient that you're going to do the nursing interventions first. We need to get the glucose down, and we need to get our patient hydrated. We're concerned about fluid and electrolytes. We're going to be checking the glucose levels. Next, let me ask you guys something. You notice that the same patient, we're talking about the Mr. Davis in DKA, you notice that his blood glucose is rapidly decreasing. What is going to be your next action? Are you going to administer a dose of insulin? Are you going to check his potassium levels? Are you going to increase his IV fluids with dextrose? Are you going to assess his oxygen saturation levels, or are you going to document? Let me repeat that. The same priority patient, Mr. Davis, that is in diabetic ketoacidosis, right? You now note that his blood glucose level is rapidly decreasing. What are you going to do? Are you going to administer a dose of insulin? Are you going to check his potassium levels? Are you going to increase his IV fluids with dextrose? Are you going to assess his oxygen saturation levels? Or are you going to document? And guys, I hope you all chose increase IV fluids with dextrose. And I know some of you guys are thinking, Professor D, what are you talking about? This patient's in DKA. The glucose is severely high. Why in the world would I give dextrose? Well, I just told you that this patient's glucose is rapidly declining. Well, Professor D, this patient's in diabetic ketoacidosis. Don't we want the blood sugar to go down? Yes, we do. But what is a one word that made you know we have a problem? Rapidly. Yes, we want to bring the blood sugar down, but not rapidly. Guess what happens? If you bring that sugar down rapidly, that patient's going to go into seizures. We're going to have another set of problems on our hands, right? So that's why you have to be very careful. We want to bring down that blood sugar. And usually when that patient gets down to around 250, that's when they'll still get insulin, but at the same time, they're getting IV dextrose because we don't want that rapid drop in glucose levels. That's something very important. You guys have to know this, okay? Now, the first option I gave you, administer a dose of insulin. Absolutely not. Their blood sugar is already dropping too rapidly. Why would we crash them out? What kills you faster, hyperglycemia or hypoglycemia? Hypoglycemia. We have to be careful. 2, check his potassium levels. Checking the patient's potassium levels, that is important because we know that giving that patient insulin can cause the patient to go into hypokalemia. So we're going to be very careful. But remember, this was a multiple choice question and we could only do one thing, right? And that one thing, because we already saw, we assessed, that's how we know that the glucose is going down. That's what we have to correct. We're going to give dextrose, then we're going to go check that for hypokalemia. Do you see why we gave the patient the dextrose before checking for the hypokalemia? Because I know some of you guys are thinking, well, we're supposed to assess the patient first. We did. That's how we know that they're that I can't speak. That's how we know that their glucose levels are rapidly declining. We assess them. We see that those levels are going down. So we have to address that first by giving the dextrose. Then we're going to check the patient's potassium levels. Again, because we understand when we give the patient insulin, it can cause hypokalemia. And remember, your potassium level is supposed to stay between 3.5 to 5, okay? We don't want the patient to have any cardiac dysrhythmias. Now, my last question to you. Out of all these patients that you're looking at, if you had to prioritize, who'd you see first, second, third, fourth, fifth? What order would you place it in? We already know Mr. Davis come first. Who else? Okay. After we see Mr. Davis and we address his issues, the next person we're going to go to is going to be Miss Edwards, the 40-year-old with a history of CHF and hypertension, admitted with what? Worsening shortness of breath and swelling of the legs. She's getting diuretics, the vital signs are stable, but guess what? She still has difficulty breathing. Right? So after DKA, which situation is most lethal? It's going to be that patient with CHF. So that's who you're going to see next. After you've addressed Miss Edwards, who are you going to see after that? It's going to be number 1, Mr. John Miller, your 78-year-old who was recently diagnosed with pneumonia. He's getting IV antibiotics, he's getting oxygen, but he still has a productive cough and mild shortness of breath, low-grade fever. That word mild tells us a lot, right? If it said severe, you'd be running to this patient. Matter of fact, let me go back to Miss Laura. If it was severe shortness of breath, you would be seeing Miller before Laura. Okay? Because with Laura, it says worsening shortness of breath. We don't know what level she's at, but Mr. Miller, right now it says mild. But if it said severe, that changes the whole thing. We'd be running to that patient next. But Miss Laura is going to come before Mr. Miller because Miss Laura has worsening shortness of breath and dyspnea, and Mr. Miller's shortness of breath is just mild. Guess what? I'm healthy. If I have influenza, I'm going to have mild shortness of breath, right? That comes with the diagnosis. There's a big difference between mild and severe. Severe, you're running to that patient. All right. So we saw Mr. Miller. Who are you going to see next? It's going to be Miss Collins. This patient that just had surgery a day ago, they're stable, but they're complaining of pain. But why are they so low on the totem pole? Because they have a PCA, right? So they have pain, they're going to press that button. They still need to be assessed. It's just not a lethal situation where you have to be running to this patient. Now, something I want you to think about, this patient just had surgery. You may get another question or another case study about a patient who had surgery. I'm telling you right now, whenever a patient had surgery, an invasive procedure, in the back of your mind, always be concerned about these 3 things no matter what. Them bleeding out, hemorrhaging. So you're going to be going through the labs. You're going to be looking at the RBCs. You're going to be looking at the H&H. You're going to be looking at the blood pressure. You're going to be looking at the pulse and respirations. You're going to be looking at the urine output, right? You want to make sure that patient doesn't have any internal bleeding going on. The second thing you're going to be concerned about is DVT. You're going to be watching out for those signs of deep vein thrombosis, such as that unilateral calf or foot pain and all those signs and symptoms that go along with that. And the third thing you're going to be concerned about, well, let me back up. I said DVT, but also DVT slash PE, pulmonary embolism. So that patient could have had a clot, they could have had a foreign body. If it moves and it lodges in the pulmonary artery, it's now called a pulmonary embolism. Okay, that's a medical emergency, by the way. So you're going to be watching out for those signs and symptoms, cough, shortness of breath, those clinical manifestations. And the third thing you're always going to be concerned about if that patient has had an invasive procedure is going to be infection. You're going to be looking at those WBCs, the ESR, the SED rate. You're going to be looking at the temp and, monitoring for all those signs and symptoms of infection. And timing is very important to you because this patient who just had surgery, if it's been within the first 24 hours, infection, is it that much of a concern? Because it takes time for your body to build up that immune response where you see the temp go up, you see the WBCs go up, the ESR, the SED rate, you see, the patient develops mucopurulent drainage, all that good stuff. You'll see that past the first 24 hours, right? So within that first 24 hours, not so much, but afterwards, absolutely, it's fair game. It's more likely that that patient is going to be at risk for infection. So those are the three things you're really going to be concerned about anytime in surgery is mentioned. And last, who are you going to see last? Your 90-year-old with advanced dementia. There's nothing going on with this patient. Yes, they have advanced dementia. Yes, they have Parkinson's. Yes, they're on total care, but there's nothing acutely happening right now that we actually have to address. And so that's why they're last on the list. And guys, that's it. This was a really short case study. I hope I explained it to you in a way that you can understand. If you'd like to see more case studies on prioritization, just so I can teach you how to think, because I'm telling you, oh my gosh, NCLEX is going to kill you on prioritization. This is something you guys have to get down pat. If you'd like to see more prioritization case studies or questions, just let me know in the comment section. I have no problem. I'd love to go over more with you. Guys, don't forget to check out my website, nexusnursinginstitute.com. Almost daily, you can find me covering nursing topics across my social media platforms such as TikTok, Instagram, Facebook, right here on YouTube. My handle is the same everywhere, Nexus Nursing. Be sure to check me out, and you guys will be seeing me on the next video.